The Honourable Member Calgary Mountain View, followed by Edmonton Highlands Norwood.
Thanks very much, Mr. Speaker. Mr. Speaker, emergency medical services continue to be overtaxed and unacceptable, especially outside Calgary and Edmonton, since Alberta Health took over our emergency system, with increased injury rates as well as delayed response times. To the Minister, why did you break a system that was working, especially in rural Alberta?
Honourable Minister, Associate Minister.
Mr. Speaker, the honourable member asked this question last week and was concerned about increased injury rates in EMT workers. And I offered last week and I'll offer again, if he actually wants to sit down and review the statistics, I'd be more than happy to do so because our statistics don't line up with his.
Honourable Member.
Mr. Speaker, since it showed a 50% increase in Calgary's emergency medical services injury rates over last year, troubling that the Minister doesn't know anything about those. EMS workers have a much higher injury rate and absentee rate since this government took over emergency services. Why?
I don't know a lot about some of the reports that honourable member comes up with, but I do know what the actual statistics are, and I'd be more than happy to sit down and review them with him.
Honourable Member.
Well, I tabled those in the House, as you know, Mr. Speaker. Unfortunately, the Minister hasn't had a chance to look at those. Poor communications, delays, misdirection from 911 are especially common in rural Alberta. Will you reconsider this one-size-fits-all in rural Alberta and reconsider 911 and EMS?
Honourable Minister.
Well, thank you very much, Mr. Speaker. As I said in answer to a question the other day, I've spent hours meeting with municipalities from across the province, including rural Alberta. I'll be tabling an article from a newspaper later today, Mr. Speaker, that quotes officials both in Brooks and in other communities saying that EMS services have improved since Alberta Health Services took over the leadership for EMS in their communities. Mr. Speaker, today a full 95% of EMS calls are handled by our 3 provincial dispatch centres. It's working well. There's certainly room for improvement in many areas, and we're very focused on that, Mr. Speaker.